Hello, welcome to episode 154 of the Inside Knowledge podcast for people with IBS. I'm Anna Mapson. Today, I'm talking to Professor Bu'Hussain Hayee, who is a consultant gastroenterologist at King's College Hospital, and he's been doing this role for over 20 years. He has a specialism in inflammatory bowel disease and endoscopy, and he has been working in the NHS for a long time and has got so much expertise. I asked him in this interview today all about bile acid diarrhea because, as you will find out, it is a very common cause of diarrhea predominant IBS. He's extremely good at explaining things and helping to share scientific information in a really understandable way, which is why I've invited him onto the podcast. He does have an Instagram channel called Prof Hayee, which is Hayee, and it's really useful and really helpful for evidence-based digestive solutions and things that you can do at home as well. It's all very clear, and there's none of the social media sort of drama around some of the things you will read online. So do go and check out his Instagram account and learn from him there. Okay, I hope you enjoy this episode. Great. Hello. So welcome, Professor Hayee. Thank you so much for coming and joining us. I know this is going to be an interesting episode. So could you just start by explaining a little bit about your role, what you do, and the types of people you work with?
Yeah, so I'm a gastroenterologist in the NHS. I see people with all sorts of problems with their digestive system. I'm interested in endoscopy and investigating people and treating them when we can, avoiding need for surgery. But the majority of my practice in the NHS is to do with people who have long-term or sudden onset gut problems, essentially. Acid reflux, problems with their bowels, all sorts. So I've been doing that for the last, let me think, 20 plus years now. So
very experienced. Yeah. And I guess by the time people have got to you, there's obviously quite a long waiting list to see people in the NHS, and often they've been to the GP number of times. So maybe you must see people when they're have been waiting a long time and sort of in a bad state a lot of the time.
Yeah, I mean, I wish we could get to see people earlier. I really do. And gosh, the number of times that people have said to me in clinic, "Oh God, if only I'd come to see you sooner," or if nobody's explained it to me in that way. And it's a real shame, but yeah, there's only one of me, unfortunately.
Well, I really like the way that you did all the series of explanations about gut health and about common sense things around probiotics, and explained it really well. So that's just why I thought you'd be a great guest to help explain many things. And I've had some questions about bile acid diarrhea, and that's why I wanted to sort of zone in on that today, just to get your expertise as a gastroenterologist about bile acid malabsorption. And I wondered if you could just explain a bit about that and talk about the sorts of presentations for people, like what would they be looking out for, just partly because people may have been diagnosed with IBS-D and have frequent diarrhea, but it's sort of escalated or maybe misdiagnosed. So I wondered if, could start off talking a bit about, what it is, and then we can talk a bit about what people would be looking out for.
Yeah, so thank you. I mean, I guess the correct term for what we're discussing is bile acid diarrhea. We used to call it bile acid malabsorption. And some people still do, and sometimes that's correct. But most of the time, what we're seeing is not a malabsorption of bile acids. So it's more correct to call it bile acid diarrhea, and then that takes hopefully some of the confusion out. Unfortunately, it means the acronym is bad. Listen, bile acid diarrhea can be really impactful on people's quality of life, but hopefully it's not that bad in terms of, at least it doesn't physically damage your gut in any way. It causes a lot of problems and a lot of symptoms, but hopefully, that's one thing to reassure people about. From our perspective, it's much more common than we thought. And if you look at the overall population, the whole population in the UK, for instance, probably the prevalence of bile acid diarrhea is around 1%. That's as common as something like celiac disease, and we get very worked up about celiac. When you then divide that population down into into people who have irritable bowel syndrome, the prevalence of bile acid diarrhea goes up to as much as 1 in 3, so 30%. So it's definitely there. It's definitely a thing. And often, as you said, as you've alluded to, it goes missed or undiagnosed. And that's the first step, I think, is people to be aware that it's a diagnosis. It's a condition that can affect you, and it's a condition that can be treated. So the first thing, I guess, to look out for me as a clinician and for people who have the symptoms is that characteristically it's diarrhea that people experience. And the textbook description is unremitting diarrhea. So often with irritable bowel syndrome, people's stool consistency and frequency changes a lot. It can go from diarrhea one day to constipation the next to normal, and vary sometimes unpredictably. But with bile acid diarrhea, we would expect it to be always the same, always diarrhea.
And when you say diarrhea, is it always like that Bristol stool chart type 7, or could it also go up to the more like mushy but formed stool? Because typically you think about like very watery, urgent diarrhea, but would it always be like that sort of consistency?
No, yes, no, you're right to ask. It's a great question, and you're right. I think we would expect to see some variation as well along the Bristol stool chart, as you say, but mostly or always towards the looser side. If you're passing normal stools or being constipated, then it's much less likely to be bile acid diarrhea.
Yeah, great. Okay. And can you explain to the listeners just a bit about what it is? Like, why would bile acids be causing diarrhea?
Yeah, absolutely. So bile acids are a normal part of your digestive system. Your body makes them, your liver makes them, and they're there to help you emulsify and absorb fat from your diet. Your liver makes them, your gallbladder stores them, and then the neat thing is that when you eat a meal, the meal hitting your stomach then triggers your gallbladder to squeeze so that the bile acids hit your intestine at the same time as the food hits, so that everything works hopefully in perfect sequence. And then the bile acids do their job. They emulsify the fat. You absorb the fat from your intestine. And then at the end of your small intestine, which is a part called the ileum, the bile acids then reabsorbed back into your bloodstream, and probably about 95 to 99% of your bile acids are recirculated every day. So we expect that the majority of the bile acids are reabsorbed, and none of them, or very few of them, enter your large intestine. So what can happen, and where bile acid diarrhea becomes a problem, is that too much of those bile acids start to enter your large intestine, the colon, and there, because they're essentially salts, sodium salts, they draw water in, and the water then results in you having lots of diarrhea, and it's as simple as that.
Yeah. And it can happen at any time during the day, isn't it? So is it true that the diarrhea is then maybe more erratic and sort of less related to foods and to timings of needing the toilet, because it's when the bile salts hit the large intestine rather than when you eat or when you're eating certain foods?
Yeah, it can be related to your food in as much as the content of what you're eating can affect how much bile acid is produced and how much bile acid is used up in your small intestine. And we do see something called a rapid gastrocolic reflex in people who have problems with their gut. So gastrocolic essentially means stomach and colon. So when everyone has that, that's a normal part of your physiology. When your stomach has food in it, your large bowel starts to move. But for some people, that happens really, really rapidly. And we can tell that by talking to somebody and listening to the timing of their symptoms. That's also a thing. But you put all of that together, and yet the symptoms can be erratic. They're not they're not often following any particular pattern. So it can be quite difficult to pin down, and often people get sort of bogged down in trying to look for patterns when there might not be any.
Yeah, which can happen in all of those sort of digestive conditions, I guess, because it's about processing food. So we're trying to find what is the problem with what I'm eating, but sometimes it
Yeah.
isn't necessarily food related. It's down to like how your physiology or how your gut's moving. And
And
yeah.
sometimes it's not just what you're eating, but to make it even more confusing, it's not just about what you're eating. It's about how much of each particular thing that you might be reacting to that you're eating in one particular go or in one particular day. So, you might have had a baguette for lunch yesterday and it didn't cause you any problems, but you have more wheat the next day, more gluten the next day, and that same baguette for lunch plus the other stuff that you had then causes a problem, and people think it must have been the baguette, but actually it's everything else on top of it. So it can be very confusing unless you pin it down with a specialist.
So with with the amounts of fats that you eat, sometimes some people get more constipated, slowing the gut down, and other people will react to fats by speeding their gut up. So it's maybe like your reaction to certain foods could be different to somebody else's as well, which is why it's quite hard to identify triggers.
Yeah, absolutely. I think so. The average UK diet, probably about 30% of our calories from fat. That's normal. I would say somewhere between 70 and 90 grams of fat a day for most people. If you have bile acid diarrhea, it makes sense to reduce your fat intake, probably down to even 40 grams a day if you can. And that can help. It's not a fix. It's not a quick fix, but it can help as part of a sort of overall package. And yeah, gut health is complex. We'd like to think. Well, I like to think that we've got a good handle on it now, with all the research that's gone on over the last 3-4 decades and more. But if you're not a gut specialist, everything can feel really complicated.
And just on that sort of gut microbiome picture, do you know much about how the high levels of bile salts may affect the microbes that are living there? Because they're already changing the environment a little bit. So...
Yeah. Oh, I'm glad you asked me that, because I think it's really beautiful, actually, if I may use that word. There are particular groups of bacteria, lactobacillus, for instance, that one of the things that they do is detoxify bile acids. The interesting thing is that they don't get anything from that. It doesn't it doesn't make any benefit for those bacteria to do that job, but they do that job for us. And and in the process of doing that, they actually die. So they are, that's a really interesting thing to note, to sort of think about, that this is going on in your gut sort of 24 hours a day, where this altruistic bacteria is doing a job for us that we don't even realize, and killing itself in the process. So that's really important. And yeah, absolutely, what you eat will definitely have an influence on your gut bacteria and the populations of bacteria that you have in your gut, and vice versa. Because people will naturally want to restrict what they're eating, and unfortunately, sometimes that can be as bad for your gut microbiome as eating the wrong kinds of things, or things that you react to already. So, again, another layer of complexity, but it's certainly something we think about. I wouldn't say that bacterial imbalance, or dysbiosis, as we call it, would be a cause of bile acid diarrhea, but it can certainly play a part, for sure. And we certainly have seen some more complex pictures with people, and I've certainly seen that with people who have had a diagnosis of bile acid diarrhea and actually have had benefit from doing things to modulate their gut health and their microbiome and soluble fiber intake and all of that, alongside perhaps using specific medication. But sometimes the impact is greater doing more sort of general gut health interventions.
And is that because they then are able to change their gut bacteria a bit in the large intestine to cope with more fiber, for example? So if they can then tolerate more fiber, then they can eat more fiber, which will help to remove more bile salts? Is that the connection?
No, well, it's not. It wouldn't be the fiber that's doing the removing. It would be the gut bacteria that's doing that. And so I've got to be careful what I say here, but because the science is very sketchy on whether doing things externally can meaningfully influence the populations of bacteria that live in your gut. But science is one thing, and what we see every day in clinic is another. And that's where I'm a bit of an anarchist in terms of, yes, there's very little science, but we do know what the biology is here. And as doctors, we always like to say we're guided by evidence. If there's a clinical trial that's been well designed and well carried out, then we can say for sure what we're doing is correct. Often with gut health, the trials just don't exist. So we kind of either we stick to our principles and say, I'm sorry, I can't give you any advice, or we look at the biology of what's going on, the underlying processes that we know exist, and we make reasonable judgments to help people out of a situation. Otherwise, when no one's any the wiser. So that's my bit of anarchy that goes on. But it's evidence-based anarchy. I think that's my phrase. Yeah.
So if gut bacteria play, a small potential part for bile acid diarrhea, what are some of the other drivers? Like, how would this develop in somebody?
Yeah, great question. So, broadly speaking, there are a few groups or types of bile acid diarrhea. The first kind is where the bit of your gut that does the reabsorbing of the bile acids once they've done their job for you, it has gone or it's damaged. And we see that in people, for instance, who have Crohn's disease, an inflammatory bowel disease that can typically affect the small bowel in that particular part, the ileum. That's also the bit of your gut that absorbs B12 from your diet. So often we see those two things going together. And sometimes the Crohn's disease just affecting that part of your bowel can be the problem. But if you've had an operation to remove that part of your bowel because of Crohn's disease as well, which is fairly common, bile acid diarrhea can be the result. Sometimes we do see a bit of adaptation. So the rest of your small bowel that's higher up, that's still left inside, you've got about 4.5 meters of small bowel. And typically, hopefully, we don't remove as much as that. That can adapt over time. So bile acid diarrhea, because of ileal pathology, can improve with time. The second type is people who've had their gallbladders taken out. And we see that all the time. And honestly, we see it so often that I'm really sometimes disheartened by people turning up in my clinic, having seen lots of doctors and knowing that their gallbladder has been removed, and then everyone scratching their heads as to why this person has got problems with diarrhea. It's such a no-brainer for me that would be the case. Not everyone gets it, but it's a well-known phenomenon. And the amount of times that I've seen somebody and said, "Oh, that's the first time anyone's explained that to me. I didn't realize." It's a really common thing for people to look out for. And then the third type, I guess, is rarer, much rarer, genetic causes. So there are some people who have problems with bile acid metabolism and bile acid reabsorption, and they're to do with particular signals inside the cells that line your intestine that cause the problem. That's pretty much that compared to the other two, for sure. That's pretty rare, but it's something that we consider.
Yeah, okay. But as a cause of diarrhea, IBS, or IBS that's predominantly very loose stools, it's quite a common cause, having issues with bile acid. Yeah.
Yeah, it's something we should always think about. So much so that one of my old mentors said that he didn't believe that there was anything such as IBS diarrhea because there was always something else causing it. I'm not sure I'd go that far, but there's certainly much more to look for and much more to test for that we didn't realize in the past. And certainly IBS-D and bile acid diarrhea are much more common coexistent than we thought. And as I say, perhaps one in 3 people with IBS diarrhea could have bile acid malabsorption or bile acid diarrhea.
And what about the testing? So if you suspect it, I know there's a couple of tests or things that people can be put through to check for bile acid diarrhea.
Yeah. I guess the test that most people most clinicians will reach for is something called a CCAT scan. That's SEHCAT, and it stands for something much longer. I can't remember. Everyone calls it a CCAT scan. That's basically a scan, a nuclear medicine scan to see that gives you radio-labeled tracer to see how much bile acid is being retained and reabsorbed into your system. It's not a perfect test, and I guess no test is 100% reliable in any given situation in medicine. So I think it's also fair to say that while that test exists, it's not the perfect test. There isn't a perfect test for bile acid diarrhea, but we do rely on it. But having a negative test doesn't necessarily mean that you don't have it. And equally, the other way around, having a positive test doesn't necessarily mean that it is bile acid diarrhea. So it can be even more confusing. But by and large, I think that's the right thing to do. The trouble with CCAT scans is they're not universally available. It's sometimes quite difficult to get one at all, and the waiting lists for those types of scans, because they're pretty specialized, can be quite long. So I think a lot of people will, I guess, pragmatically, even though it's not necessarily part of our national guidance to say that this should be the thing that we do, but a lot of people will just try a bile acid treatment to see if it works. And I think that's not an unreasonable way to go. It's quicker for sure than waiting for a scan, but I think the scan would give us and give you as a patient more reassurance that that's exactly what we were dealing with. So it's a bit of a mix and match, but the treatments work. Is the other thing.
Yes, and so the bile acid binders, can you say a bit about those?
Yeah. So again, another interesting thing. One of my kind of tenets is that I wouldn't put through, within reason, I wouldn't put anyone through something that I didn't really understand or hadn't been through myself. So I actually tried some bile acid sequestrant a long time ago to see what it was like. And it was like drinking concrete. So cholestyramine, which is the powder that you can get, comes in sugar-free if you're diabetic, but it works very quickly. So it can work within a few days even of starting it. So that's really positive. That is a positive thing about cholestyramine. The negative is that it tastes horrible. So that's the reason why sometimes we shouldn't necessarily rely on what we would call a therapeutic trial, a trial of something just to see if it works, because cholestyramine tastes so awful that often people will either use it incorrectly or not use it at all, and dare I say it, pretend that they have and just say it's not working. So the other treatment, colesevelam, which wasn't designed for bile acid diarrhea, but it was designed for lipids in your blood, so cholesterol and control and things like that, but actually works through the same mechanism as cholestyramine. And colesevelam is a capsule, so it's much easier to take. And the best thing about colesevelam for me, not just that it's much more well tolerated, is that you can vary the amount that you're taking. So you can really suit your own situation, up to 9 tablets a day, or 9 capsules a day, but somewhere along those lines, and you can vary the dose quite effectively.
And the way that they work is that they're attaching to the bile salts, is it? And
Yeah,
taking them
essentially,
out.
yeah, they're sequestrants. So when the bile acids come into your colon, they're gone anyway. Your body won't be able to reabsorb them, so they're no use to you. So the sequestrants essentially bind them, mop them up like a sponge, and then you can get rid of them in the natural way. one of the things that we see when people start these sequestrants, depending on how effective they are, is that you go the other way. You suddenly become really bunged up. And for some people, that's even worse because you go from one end to the other and it's much more uncomfortable. So there is a bit of tailoring that needs to be done because everyone's different. They'll respond differently to the same dose. So that's another advantage of colesevelam for me, is that you can really find the dose that's right for you, as opposed to just taking the one sachet of cement.
Yes, doesn't sound very appealing. Yeah,
It's gritty, yeah.
it's good that you tried it yourself and you can really understand their pain.
Once was enough.
Yeah.
Yeah.
Yes. Okay, that's really, really helpful. Just in terms of like diets, I know you mentioned you're reducing fats to around 40 grams a day, but do you give any other dietary advice for people who have issues with their biles?
Yeah, depending on what's causing it, of course, and depending on what the picture is around the bile acid diarrhea, we're not just one thing. We're all human beings, and it's about what people are ready to do with their food and with their lifestyle as well. It's not just we can't just say this is what you need to do. We have to take the whole person into account. But yes, apart from a fat intake, I would say that we should also be looking at your overall gut health, your soluble fiber intake, your nutrients, your vitamin and mineral supplements. We don't, by and large, see a whole host of problems with vitamins, particularly fat soluble vitamins. That's A, D, E, and K with bile acid diarrhea. But they are something that we're aware of, particularly vitamin D. And many of us will have issues with vitamin D levels in the Northern Hemisphere anyway. So it's something that we're super aware of. And so general gut health measures, vitamin and mineral supplements, and fat content of your diet is where we would focus. Yeah.
Yeah. Great. Okay. And is there anything else, you would advise people who are worried about whether their diarrhea is tipping into that, anything that they should be asking their GP about in order to get a referral to see somebody like you, or patterns that they could watch for?
Yeah, really practical is just to ask that question of the doctors that you see, is that I have IBS diarrhea, or you think I have IBS-D. Could this be bile acid diarrhea? And just ask that question, and then react to the response that you get from your doctor, I guess. If they dismiss it, then I think you could reasonably pursue that, because it's so common in people with those symptoms. It's 1 in 3 people up to. So I think it's an entirely reasonable question for people to be asking.
Yes, yeah. And any other just more general sort of IBS advice that you would give to people? Almost everyone I work with or listens to this has IBS and issues with long-standing, normally, issues with their gut.
Yeah.
What are the sort of common either mistakes that you see people, or advice that you're sort of dishing out all the time?
Gosh, yeah, that's a whole nother podcast. I guess. Listen, if there's one thing that I wish everyone would do more of, is to focus on soluble fiber intake. If it's the closest thing we have to a magic bullet for our gut health. Not that there is one, but soluble fiber comes close, I think. Most people who have gut problems will need around the science, and there is science for this, says that you need around 15 to 20 grams of soluble fiber a day. Most of us don't get anywhere near that amount, even if you're eating well and eating a healthy diet. The average UK diet contains somewhere around 5 or 7 grams a day. So, and if your gut's in distress, many of the foods that you would reach for to supplement your soluble fiber intake will cause problems for you, because they're quite difficult to digest. They come packaged with other stuff naturally. So the easiest way to get more soluble fiber is to supplement it. And it doesn't have to be an artificial supplement. It could be chia seeds. Chia seeds, really good source of soluble fiber. Not everyone gets on with them. So then flaxseed is another one. I like psyllium husk for people who have loose stools, because it gives you more bulk and firms up your stools. And psyllium husk can be tailored. You can use a small amount and build it up gradually. There's also another one called PHGG, partially hydrolyzed guar gum, which I'm a big fan of, because for me it's one of the best tolerated forms of soluble fiber. It doesn't cause a lot of irritation or bloating like the others can. And again, you can start low and increase slowly.
Yeah, fantastic. And that's less fermentable one, isn't it? PHGG.
Yeah.
So it's well tolerated. Yeah. Amazing. Okay. Thank you so much. That was really, really helpful. Thank you.
My pleasure. Thanks for having me.
I hope you enjoyed that interview. I really did. It was an absolute honour to speak to him, and I really think there was so much helpful information in there for people who have diarrhea predominant IBS. So if that's you, take some notes, take it to your doctor, make sure you have had that ruled out as a cause, because as he said, there is treatments available. There's things that you can be doing if you know that that's what's causing your loose stools. And if you have an idea of a topic you'd like me to investigate, then please do send me an email. It's info@goodnessme-nutrition.com. And you can ask me to investigate another area, or if there's somebody you'd like me to interview, then please do let me know. Okay, we'll leave it there for this week. Thank you so much for listening to this episode of The Inside Knowledge. Better digestion for everyone.